Okay, so thank you, Juliet, very much for the welcome. As indicated here in my title and in the introduction, I'm going to be talking to you today about some of the work and the conversation going on within island health, trying to understand our role as public health practitioners in response to drought. Drought is kind of a tough one because it has very wide-ranging potential health impacts. And so although public health professionals are almost certainly responding to drought in some form, we don't often think of it as a drought response, or we don't write about it as a drought response, which makes it really difficult for researchers like me to collate information on how public health is responding to drought. So my hope for today is that we're going to share some stuff, and that also folks on the line will feel inspired to pipe up and share their experience and resources about how they are interacting with drought in their jurisdictions, just as we are. Okie dokie. All right. Before I get started, Nancy and I today are joining from the areas currently known as Vancouver Island, which are the traditional unceded territories of the Coast Salish, Nch'Aneth, and Kwakwaka'wakw peoples. These are within these three language families. There's about 50 different First Nations that Island Health serves here on the island, as well as 6 chartered Métis communities and a number, six Métis communities and a number of friendship centers as well. So we're very grateful to live, work, and play here. The picture on the screen is also my background. I live in this really beautiful agricultural area that is now known as Duncan. I think Nancy's up in Campbell River. So yeah, just sharing a little bit of the beauty from the island this morning. Okie dokie. So just to base us on something, what is a drought? So there's various different definitions of drought. They can be meteorological, hydrological, agricultural, or socioeconomic. Obviously, one kind of drought kind of rolls into another. But what I'm starting today with as my basis is a meteorological drought. And so this is when changes in the amount of precipitation that are falling into a watershed are or are not matching up with the thirst of the atmosphere, the amount of water being drawn up through evaporative demand and leaving the watershed. So we can have a drought because there's these two factors kind of playing off each other. We can have a drought even if precipitation doesn't change, or even if it increases. So this is important to know because for the future climate for island communities, or the communities served by Island Health, we are actually expecting about a 10% increase in precipitation over the next few decades, but we're also expecting 2 to 8 times more hot days, so days that are hotter than 29 degrees Celsius, by about 2100. And so when I say 2 to 8 times more hot days, in some places that means 45 or 50 days over 29 degrees every summer, which is very hot. You don't have to be a gardener to know that even if you get a lot of rain, it doesn't take much very hot weather to completely dry out the soil and start damaging plants and having other impacts. So these are my bean plants dying off in July. I was quite annoyed by this. But yeah, so really the question that we're asking ourselves is, given that island communities are going to have some pretty severe drought impacts, or potentially severe drought impacts in the future, what's our role in preparing for that? So I'm not going to spend a lot of time on this because it's a big ugly slide, but we started thinking about kind of what are the climatic changes that are leading to drought. Those are things I've mentioned about, like the long-term decreases in rainfall, increased warming, decreases in snowpack, earlier snow melt, and just generally increased evaporation. And those things together in a watershed lead to a bunch of ecological consequences that may not be directly within the realm of public health, but are definitely impacting us. So those are leading to things like, overexploitation of ground and surface water, soil compaction, shallower recreational waters, increased wildfire risks at the same time as having less water to fight them. So these kind of ecological consequences kind of trickle down into some health impacts. And these are kind of getting closer to our public health practice, around inadequate drinking water quality and quantity, increases in water and vector-borne diseases because water is getting warmer and shallower, deteriorated relationships with the water and the land, which is, here at Island Health, we say our health system, or our ecosystem is our health system. So this is something that we care about. quite deeply. There's also some injury consequences here if we're diving into shallower waters, food security issues. Drought doesn't always coincide with heat, but when it does, it makes the heat impacts worse. So there's some heat exposure concerns, and of course, respiratory health impacts, which is where I spend most of my time working. So I'm going to kind of go through this last row here, kind of one by one, and talk about some of the projects that we're either embarking on or thinking about, or maybe what some other people are doing and we're considering. And as I said, please, as we go through this, if you're struck with ideas or great resources or tools and you want to pop them in the chat, that is deeply appreciated. This is intended to be more of a dialogue rather than a, lecture type. So obviously, one of the main roles of public health in responding to drought is just in improving drinking water system resilience. And Nancy's going to be talking a lot more about this later on, so I won't get into it too much. But, obviously, the main tools for water conservation are things like water use restrictions and bylaws, and also water metering and leak detection. This is something, different parts of Canada are in different places. But, water metering has become a really important thing just to know how much water is being wasted at the end of the user. Nancy will be talking a bit more about water source and water system assessments. So I won't get into that, but I just kind of generally want to flag for public health folks that, we should probably be thinking about monitoring for chemical changes in source water a little bit more if there's a drought on the horizon or, it is in progress. And that's because there is an increased risk of contaminants in overdrawn wells. So things like nitrate and pesticides like orthophosphates, if they're still in use where you are, which I don't think they should be, chlorides, sulfates, and arsenic. Arsenic is a big issue in BC and other parts of Canada. So when wells are being drawn hard on, we can expect contaminants like these to go up. Also, in terms of surface water, you would expect to see elevated phosphorus and nitrogen in rivers that are flowing very low, but still getting inputs from the surrounding communities. That's leading to a risk of just kind of more algae generally and impacts on fish, but also the risk of harmful algal blooms, which usually cause quite a bit of anxiety in communities. So we need to be communicating around those risks. Nancy will be talking a little bit more about saltwater intrusion in overexploited aquifers. I won't get into that, but just kind of generally all these potential drinking water quality and quantity impacts mean that public health may need to be issuing and helping to resolve more water advisories in the future. So this is something that we've been kind of folding into our own planning, which Nancy will speak on. Groundwater is a particular concern and interest of mine. Here on the island, groundwater wells are used for both community systems and private systems. I think Cornell can connect or correct me if I'm wrong, but I think there's something like 40 to 50,000 wells on the island, and only in the last couple of years has there been a push to actually start getting them registered. So we have a lot of uncertainties about the number of wells on the island and their usage and their vulnerability especially. So chemical and microbiological testing are of course recommended for private wells and required for water systems, but they may not be up to date. At the individual scale, we have very limited information on those individual wells. And then at the basin scale, we have I wouldn't say very limited, it's somewhat limited groundwater mapping and relatively few government monitoring wells, which has been something that community members have brought up, that this is a gap for them, but potentially it's not really clear how much expanding those systems would actually fill the knowledge gaps that they're contending with. So some actions we've been talking about within Island Health are, some very direct response things like creating some resource lists for homeowners if their well goes dry. So kind of like local water haulers. People here on the island can be quite dependent on water haulers, and there's actually not that many different companies that do it. So if there's all of a sudden a drought and a big demand for water, you can have those water haulers unable to satisfy the demands in the community. So that's a potential issue, but also encouraging people to find tank rentals or other forms of water storage, etc. We also want to be encouraging well owners to follow municipal restrictions, even though they're on a private well. The kind of idea is that water is shared, and if the town of Duncan is at stage 4 water restrictions, then private well owners should kind of absorb that and also reduce their own risk or reduce their own use where possible. just out of the recognition of the shared resource. And then another thing I've been looking at quite a bit recently is these volunteer well monitoring networks. So there's a lot of technological potential with the availability of cheap, low-cost sensors that are connected. They're data loggers, but also connected via cellular data that they can actually be installed in wells, private wells, that are volunteered, and we can use those essentially as a network to look at what wells in the neighborhood or what wells in the region are doing during a period of drought. So that's something that's being done by Nanaimo Regional District right now, and yeah, I think it's just a really great idea. Rec water is an interesting one. Obviously, there's an increase of pathogens and harmful algal blooms just because of the depth and warmth issues, but there's also some indicators that drought might also be associated with injuries in water, either because more people are out on the water partying hard and hurting themselves, or potentially because water bodies are changing. So there may be more like boat hitting the bottom accidents or diving into waters that are a lot more shallow than you thought that they were. So these are potential risks for how people use the landscape, and that's a big concern for public health. Just, not only we don't want people to get injured, but we want to preserve recreational opportunities and preserve those connections to the landscape that, helps people feel appreciate the natural world a bit more. So we've been talking about things like more signage, closer oversight, so very basic environmental public health stuff, but there's also some citizen science opportunities here. So BC has an algae watch observation map that's hosted by the provincial government, where you can go in and if you see an algal bloom, for example, you can go and register it on this site, and then other people, people can avoid that area if they don't want to swim there or they shouldn't be swimming there. So the only issue with citizen science projects is, of course, engagement. So engagement tends to be high at first and then tends to taper off. And that's what I've noticed with this map. There doesn't seem to be a lot of reports this summer, unfortunately. So increasing surveillance and increasing the assessment of the impacts of those diseases. So GI illness generally is a potential drought risk because of the rec water stuff I've mentioned, and generally having less water for hygiene. And, that also goes for increased risk of foodborne GI illness. So the particular pathogens that have been associated with drought are Campylobacter, C. perfringens, Vibrio, and E. coli. These are things that I think we already surveil for. So really the message is, well, first of all, understanding, trying to pull out from that surveillance data, what is the actual connection to the drought conditions? Is it there or not? That's not something that I don't think that we're doing, and I'm not sure that anybody else is doing either. But the other is just to put out a key message of not conserving water in such a way that it compromises hygiene. So this came out a lot in the US's, the EPA and the CDC in the US's guidance on public health in response to drought. Vector-borne disease is also a potential issue. So obviously mosquitoes like warm, shallow water. We do have West Nile virus in BC and many other parts of Canada, although not quite on the island yet, but it is on our radar. Luckily, however, ticks don't like drought. So take that, ticks. Here's one of my personal rages is dipper wells. I hate dipper wells. I know they're important. Environmental health officers, okay, don't come at me, but I hate how much water they use. So just as a little example, this little student project down in Las Vegas looked at about 2,400 dipper wells at 1,100 food establishments using 106 million gallons of drinking water per year, which is enough for about 650 homes. And so this is, no, they're necessary, but this is an example where maybe, environmental public health is an opportunity to develop some alternative guidance to help food establishments and processes reduce their water use. And I know, for example, down in Georgia, there has been a lot of work on this. I have some resources from them about how to help food processors reduce the amount of water they're using, not just in their operations or in their their employees' behavior, but actually in their processing itself. Food security is also a concern that has been raised to us. So obviously agricultural drought impacts on food security. So Within Island Health, we've been doing things like strengthening our partnerships with food hubs and food baskets, school meal programs. So we have a set of community health promoters and school health promoters that are out there working around food security issues. So there's an opportunity there to talk more about drought. As I mentioned, heat and drought sometimes go together, not always, but when they do, it tends to be amplifying. So obviously, heat response across Canada has seen a huge lift in the last 10 to 15 years. I think most places in Canada already have pretty well-developed heat response plans. One thing that we're working on right now, or we're very strongly interested in creating, is working with local governments and community groups to support heat response checks. So a year or maybe 2 years ago, the NCCEH came out with their heat health check tool, which has now been used all over the world. It's quite a great tool. It's basically a way that's a guide that a layperson or a volunteer organization or someone can take, and they can use it to conduct their own in-person or remote health check for a person that may or may not be experiencing the impacts of a heat event. And so we're really interested in trying to get this happening more in communities, not through us doing it, because of course we don't have the community, the contacts with community members or their phone numbers or stuff like that. So we want to find community partners who have those databases, have those contacts, and can do the volunteer work of connecting with those people. So, and then, obviously Island Health will help train them and provide these resources and support them in whatever way we can. So we would really like to see more of these community health checks happening. That's something we're going to push for in the future. We're also obviously urging preparedness at home. There's no substitute for preparedness at home. And we are doing a lot more. We're working on doing more surveillance for heat-related illness to inform our response. I work mostly around air quality and respiratory health. So this spring was really interesting. After the big drought last year in BC, the extremely dry conditions, this spring, pollen-producing trees just went poof. I had like yellow clouds all over the plants in my garden for a couple of weeks in the spring. And that's just because they're stressed and they're trying to reproduce like crazy. But that has some impacts for allergy sufferers. We would also expect to see more dust and smoke from wildfires during drought periods. So some actions for us here are doing more public education on air quality monitoring and alerts and how to use them. So that's been a big focus this summer. I'm also working directly on expanding the network of community PM 2.5 sensors to parts of Island Health, parts of the island that don't have air quality health index forecasting provided by the provincial government, because there's no government monitor there. So we're using the purple air monitors, trying to get them out to remote communities, and then trying to help people understand how to use the data essentially that comes from that. Yeah. So the last thing that I wanted to just mention, this is the biggest impact of all, which is of course mental health impact. As with many things in climate change, the biggest impact is the mental health impact. And in Australia, there's been a ton of literature over the last 20 years looking at the effects of drought on farming families, and especially farm workers, youth, and older men, and how deeply extended drought periods can impact people. So I really have been looking over these Australian resources to understand some potential actions for us, which are things like partnering with rural and agricultural organizations to bolster rural mental health programs, something that we're not, I don't think putting enough energy into right now. And there's some really great examples, as I mentioned, from Australia, especially their national mental health strategy, which is really focusing on suicide prevention for those agricultural workers, and kind of community building generally. So, as mentioned, the impacts of drought are very, very wide ranging, and it can be hard to pin them down. So just before I hand it over to Nancy, I'm going to cover a couple of tools that we have at our disposal, and some that are not at our disposal yet. So here in BC, we have the BC Drought Information Portal, and this is a very basic portal right now. It really just shows kind of period or regions under drought and like kind of their drought level. It has some historical drought maps if you're interested in looking back in time. It has some data that you can access. But right now, this is not an active map. Right now, this entire island is level 5 dark red drought. So I have not updated this photo. I should have done the presentation, but we're currently in a level 5 drought. In the US, there's the US EPA, the CDC, and some other groups have been doing a lot more work on trying to capture and communicate the impacts of drought. So one very basic way that is being done is here at this Public Health and Drought Conditions webpage. It's a CDC webpage, where they're just basically trying to like overlay air quality measurements, which is very easily available data, with drought monitoring, also easily available, and other things like heat warnings. So basically you can see, as if you kind of like use this tool to kind of scroll through a season, you'll see where the drought pops up, the heat pops up, the air quality goes badly, and you can see those things are kind of meshing with each other. But these are just the very available data sets. They don't really encapsulate the impacts of drought. So another interesting tool, which was created by the National Drought Mitigation Center, is this drought impact reporter. And this is actually the work of, the NDMC has essentially a moderator who spends all his or her time scraping media reports for mentions of drought and its impacts, and then collating them and putting them into this this dashboard. And I think they've been doing this since 2005-ish. So the impacts are classified kind of down here, as you can see, agriculture impacts, business, fire, society and public health, water supply. And so it's just really interesting to kind of click through these media mentions and see how people are talking about drought, what they see the concerns are, what are they really worried about. And yeah, I mean, it's all through the lens of some reporter of the media itself, which we know can skew the view a little bit, but I find this very interesting to scroll through. This is also from the NDMC. Basically, somebody at the NDMC really likes making dashboards because they've got a lot of them, but they've also got this one where it's the Condition Monitoring Observer Reports dashboard. And this is actually, it's not a moderator. These are actual people who will sign in from their location, provide photos, provide their own personal, like very local level drought report and like their experience over the past few years. So this is also has been quite interesting. There's yet another dashboard that collates tweets and other kind of like social media stories about drought. Again, very skewed view on that sometimes. So it's not like scientific data, but it is interesting to talk about how people, or to see how people are talking about and experiencing drought in their own words. So I'm going to pass it over to Nancy here, and I'll run the slides for her.
Thanks, Angela. Angela's kind of touched on some of the higher level projects that we've been working on. So I'm going to share with you a little bit of what we've been doing more on the ground and locally. And we're going to start with looking at our emergency response and contingency planning as it relates to our drinking water systems. So next slide. So just to understand where we come to this work, sort of in my tenure here within Island Health, we had our first sort of drought episode in about 2015. And then subsequently in 2021, we had our really devastating heat dome and then subsequent drought that year. And every year since 2021, we've had varying duration and intensity of drought. So we've been looking at how we're going to respond to that. How do we support our communities to make sure that they're building resilience and that they have the adequate response to this situation. So in 2023, we started our emergency response planning project. And just for context, we do have our authority under legislation to enforce the Drinking Water Protection Act and the Drinking Water Protection Regulation. And it's under that legislation that drinking water systems are required to have emergency response planning. So we opted to go for that low-hanging fruit, what they're already required to have, and try to ensure that they had robust plans to respond to drought. So next slide. So considering that authority that we have under the legislation, we sought to support them in the development of those plans. So what we did was we developed templates for different sizes of drinking water systems to help guide them to think through the process of what they would need to do to respond to a drought event. We also hosted workshops across the region in person and online to assist them in developing that emergency response and contingency plan. Now, what was important to understand is that although a lot of our water systems already had emergency response plans that spoke to a loss of source, typically when we started to tease out that information, what we were finding is, they considered a loss of source like a short-term thing, like some type of damage to the infrastructure that could be repaired in a day or two. We know that drought events tend to be very long and protracted events, and so they didn't have that appropriate level of response to respond to a very long event. So that's why we started to create a more specific response to drought. So we also looked at what other tools and resources the operators needed to quantify use and availability of water. When we look at the water systems that we regulate, about 3/4 of them rely on groundwater supply, and most of them don't have any capacity or ability to measure what's happening in the aquifer. So it's out of sight, out of mind. So as long as the tap keeps running, they were happy with that. So, indicating that, when the water stops is when the emergency starts wasn't really a great indicator, we felt. So trying to encourage and support them in identifying quantity as well was really important to us. The other piece that we have within the legislation is the requirement for chemical water testing. So typically we're looking for that every 5 years. So what we're looking at is making sure that we're following up on that mandate and getting that chemical testing done with our drinking water systems every 5 years, so that we can monitor for those changes. Because as Angela mentioned earlier, we can see those changes over time, and, we'll start seeing, elevated levels of things such as arsenic. That's also an indicator. Some of those test results are really great indicators as well, to help us monitor for increasing risk around saltwater intrusion. So it's really important to have that data so that we can monitor these systems and areas over time. So next slide. So the other area that we're starting to focus on is source water protection planning. So really, we need to take a holistic view, not just end of the pipe water usage, but from source to tap. So next slide. We're looking at what further actions we need to take to protect the drinking water. So our environmental health officers are going to be targeting this source to tap assessment for all of our drinking water systems. And what that allows us to do is identify and address the risks, because not all water systems are going to have the same challenges. So it's really important to understand for those water operators what the risks are and what they can do to address those specific risks. And as well, we want to continue the conversation around quantity as well as quality. You can have the best run treatment and disinfection system, you can have the best distribution system, but if you don't have any water, that doesn't matter. So making sure that we fully understand how much water is available for use, and how we're allocating that water to all the different users within the ecosystem is a really important piece of the conversation. So next slide. So touched on already a little bit about saltwater intrusion. So being a coastal area, saltwater intrusion is definitely something that we are concerned about, and we are definitely kind of keeping an eye on. So obviously within our structure, there are different organizations at the provincial level as well as the health authority that have a vested interest in drinking water and groundwater supplies. So there's, a couple different agencies looking at this, but we need to consider the risk at time of land development and densification. So just because we have space to densify an area, is it reasonable, practical? Is there that water available to supply that increased densification? And what risk does it potentially pose at creating a saltwater intrusion event within that area? So this is where that monitoring piece comes in. So there is that monitoring through some of the provincial monitoring well systems. There is also monitoring at our permitted drinking water system, and as well there is a bit of monitoring at different private wells as well as permitted wells. So we're looking at gathering all that data from those different sources to try to identify sort of our highest risk areas. And then also communicating strategies to mitigate that risk. So this is an image that I have from our Ministry of Water, Land and Resource Stewardship. They've got some great handout sheets talking about the risks of saltwater intrusion as well as mitigation strategies. So lots of great resources that are available. So next slide. So the next piece of the puzzle is water conservation planning. So it's important that we properly allocate the water that we have and that we're not frivolous with its use. So next slide. We talk a lot within Island Health that conservation needs to be our normal practice. So we need to not just talk about water conservation and you know, that conversation in July and August when it's really, really hot out and we're looking at high drought ratings. Water conservation needs to be something that we do every day. And it's a progression in changing behaviors. So it's something that will take time. And this is an important conversation for our drinking water systems as well as for consumers. There's opportunities on both ends there to look at what conservation strategies we can employ. So things from the water system level, you know, looking at things like leak detection. How much water is that water system losing before it even gets to the end user? What strategies do they have for encouraging conservation among their users? So do they have a water monitor or a water meter project? Are they communicating this to the users through, you know, water restrictions? There's also the obvious consumer side. So I'm sure everybody here has heard, you know, well, cut your shower down by 2 minutes and you'll conserve X number of liters of water, which is really great. But it's important that the conversation be held across the board. So all water users need to have that thought in mind to make sure that there's enough water for everybody. There's also a really interesting conversation around water conservation versus expansion. So if the water system is completely maxed out, the next step that people often think of is, well, we need to expand the water system. But the conversation needs to have, well, if we are conservative with our water use, do we even need to expand that system? So if we start addressing leak detection, if we start, you know, being more conservative with our water use, you may be able to avoid that expansion cost, which typically is very significant, just through those conservation efforts. And typically conservation will cost significantly less than a big expansion to a drinking water system. The last piece of that puzzle there is also around asset management planning. So ensuring that systems are properly maintained to make sure that they don't become leaky, or understanding that infrastructure has a lifespan. Again, it's something that we typically, you know, out of sight, out of mind. So the pipes run under the ground, we don't see them. If they are, you know, full of leaks, we're losing a lot of water, but it doesn't get noticed per se. So ensuring that we understand the asset management piece to replace the infrastructure as it ages out will prevent that significant water loss. And there needs to be some more conversation and action around the development of non-potable water uses. So looking at promoting and encouraging things like rainwater harvesting for watering people's gardens, or other non-potable uses like toilet flushing or laundry. There's also a lot of conversations and complexity around gray water reuse. So what do we need to do to start looking at that as an option and something that we should be considering? So next slide. So a lot of it does come down to collaboration and partnerships. So it's really important because there's a lot of different agencies that have an interest in water in a lot of different ways. So it's important that we all work together and that we understand each other's roles in the process. So currently, Island Health sits on the round table with the Ministry of Water, Land and Resource Stewardship to discuss issues around drought. We also sit on the West Coast Technical Drought Working Group, which is the regional group that sets the local drought levels. So very important to be, at that table as well. We also interact a lot with local governments and also our local First Nations communities to support and build that resilience within our communities. And the other important piece is Island Health is a large corporate citizen. So we also need to look internally and make sure that, as an organization, we are also ensuring that we're doing our part around water conservation and working with our communities to address that. So the important piece, in the work that Angela and I and the whole team here at Island Health is really just continuing to move forward in this challenging time of constant change. So continuing to work in this realm and identify what the potential risks are and how do we, not only respond to the emergency, but also build that resilience within communities. Because if communities are resilient, it feeds back into that whole mental health piece. Whereas if people feel they're prepared, they feel they're addressing the risk, that helps with the mental health piece. So it's all interconnected, and it's a real privilege to be doing this work. So that's the end of my piece of the presentation. We do have a couple questions posed, and I have seen lots popping up in the chat. I don't know if Juliet, you want to take a stab at that?
Sure. I mean, we can leave these questions up for people to bring into the discussion. We do have some questions, but first of all, would just like to thank you, Nancy and Angela, for an excellent presentation and some really insightful thoughts for us to consider as we open this discussion session. As mentioned, the discussion and Q&A portion is not recorded, so I'll stop